Let us see about the bones, the structure of a bone. Little introduction. Bone is a calcified connective tissue consisting of cells called as osteocytes. So here we can see the osteocytes. So the osteocytes are the cells present in the bone which are embedded in the matrix called as the ground substance, matrix of ground substance, and also collagen fibers. So the ground substance is made up of organic and inorganic substances, and also it contains collagen fibers, and within this ground substance we see the osteocytes which are embedded. So it is a hard connective tissue and modified connective tissue. It is hard because it is calcified, and it has got the outer layer called as periosteum, and it has a outer superficial thin layer of compact bone. So the peripheral layer is the compact bone. This is the compact bone. In compact bone, we see the regular arrangement of osteocytes surrounded by layers of connective tissue, that is ground substance called as lamellae. So uniformly arranged lamellae is seen in the compact bone. And as we move inner aspect of a bone, it becomes spongy. So the compact bone is on the peripheral aspect, that is the superficial thin layer of compact bone, and around a central mass of spongy bone, and which contain internal soft tissue called as bone marrow. So here is the bone marrow where the blood cells are formed in fetal life. And in adults, the shaft of a long bone is the red bone marrow is replaced by yellow bone marrow, whereas the epiphysis, the red bone marrow, will be persisting in adult life also, which produces blood cells. And this bone, it serves as a reservoir for calcium and phosphorus and acts as a biomechanical levers on which the muscles act to produce the movements which are permitted by the joints. So the movements permitted by the joints are because of the movement of these bones, and these bones provide attachment to muscles. So this is a basic introduction about the structure of a bone. So it is a hard connective tissue, it is a modified connective tissue, it is mineralized, calcified, containing calcium, phosphorus and other minerals, and it also has the characteristic growth mechanism and resistant tension and compression stress. So that was about the features of a normal bone. We shall discuss about the long bone in detail. Based upon the shape of the bone, we can classify the bones as long bones, short bones, flat bones which are present in the cranium, and the pneumatic bones which are air-filled bones present in the face around the nasal cavity, forming paranasal air sinuses. And also there are bones like sesamoid bones which are developed within the tendon. So there are various varieties of bones, among which we are going to discuss long bone in detail. So the long bones have a shaft called as diaphysis. So this is the shaft which contain the diaphysis, and the two ends which is called as epiphysis. So metaphysis is the part of diaphysis adjacent to epiphysis. So this part, this plate is the metaphysis. So the diaphysis forms the shaft central region of the long bone, and it is composed of thick tube of compact bone which encloses the marrow cavity. So you can see the proper compact bone in the, and here the bone is sectioned to show the inner aspect of the bone as well. So inside we can see it is hollow, which is usually filled with the bone marrow, yellow or red bone marrow inside the shaft. So the metaphysis is that part where we can see it is a line of fusion. In adults we can see it is a line of fusion where the epiphysis meets with the diaphysis. So the growth between the diaphysis and epiphysis during the bone development happens at the metaphysis. So the epiphysis, which are expanded ends, which usually they are articular ends which are covered by the articular cartilage. You can see the blue colored one is the articular cartilage, which is an hyaline cartilage, covers the epiphysis and separated from the shaft by epiphyseal plate during the bone growth. So during the bone growth where we set the metaphysis, in that region we can see the epiphyseal plate forming, and which is made up of hyaline cartilage. Later it gets completely ossified to form a complete bone in adults. So this is the diaphysis, metaphysis. Here we can see metaphyseal plate, which is a junction between the diaphysis and epiphysis. And here is the proximal epiphysis, and here is the distal epiphysis. So let's talk about the types of epiphysis also. There are 4 types of epiphysis. First one is the pressure epiphysis, where the part of the bone involved in the weight transmission and are usually intracapsular inside the joint are pressure epiphysis. For example, so here we can see the pressure epiphysis. The head of the femur is the example of pressure epiphysis. Similarly, the head of the humerus, condyles of the humerus, condyles of femur, tibia, all these are examples of pressure epiphysis, where they are located within the joint capsule and they are involved in the weight transmission. The next variety is the traction epiphysis. So here we can see the lesser trochanter and the greater trochanter of femur, which forms the traction epiphysis. It is present at the ends of the bones and developed due to the traction of attached muscles, and are therefore they are extracapsular. They are not inside the capsule, they are extracapsular. Example, greater and lesser tubercles of humerus and greater and lesser trochanter of femur, which you can see here in the image. So these are the examples of traction epiphysis. Even the upper end of fibula is also an example of traction epiphysis, where it provides attachment to biceps femoris muscle. So these epiphysis, this traction epiphysis, usually they ossify later than the pressure epiphysis. So next about aberrant epiphysis. So the aberrant epiphysis, uh, these epiphyses are the deviations from the normal anatomy, and they are not always present. So these aberrant epiphyses are not always present. Usually they are the deviations from the normal anatomy. And for example, here the epiphysis of posterior tubercle of talus. We can see here the talus bone, the projection from the talus, posterior tubercle of the talus, which is otherwise called as trigonum, is an example of traction aberrant epiphysis. And also the head of the first metacarpal. So the head of the first metacarpal is also the example of aberrant epiphysis. The next last variety of epiphysis is the atavistic epiphysis. So here we can see the atavistic epiphysis, and these types of epiphysis, they are fused bones and with a normal larger bone. So developmentally it is actually a separate bone, but later it fuses with the principal bone. Example here is the coracoid process of scapula, which has been fused with the scapula in humans with the main bone called as scapula, but it is a separate bone in lower animals. So such epiphyses are called as atavistic epiphysis. So example here is the coracoid process. You can see the coracoid process attached to the scapula. So these are the varieties of epiphyses. Next, we shall little bit talk in detail about sesamoid bones also, because they are very important clinically and functionally. Sesamoid bone develops in certain tendons, and they are mainly meant for the reduction of friction on the tendon. So it is like a pulley over which we put a rope. So the pulley will reduce the friction of the rope, and it also changes the direction of the pull. So that is the function of a pulley. Similarly, the sesamoid bone also does the same function like a pulley, and they are commonly found in the tendons across the ends of the long bones of the limbs. And the main feature here in the sesamoid bone, the outer covering of the sesamoid bone, usually the long bones will have an outer covering called as periosteum. So here the outer covering, the periosteum, is absent in sesamoid bone. So that is bit in detail. So these sesamoid bones are ossify after birth usually, and there is no Haversian system in the sesamoid bone. Haversian system we would discuss in histology of the bone in detail. As of now, the proper lamellar arrangement of the connective tissue present inside the bone, that is the ground matrix and along with the osteocytes, if they are arranged in a proper lamellar fashion without any gap, which you normally see in compact bone, and is called as Haversian system or osteon, and such Haversian system or osteon is absent in the sesamoid bone. And functions of the sesamoid bone, it minimizes the friction, as I said earlier, and it also alters the direction of pull of the tendon and reduces the stress of the bone and maintains normal regional blood supply and provides additional articular surface to the joint. So these are the main functions of sesamoid bone. Sites of sesamoid bone, in the ear we can see this is the incus. So the lenticular process of incus means here this one. The lenticular process of incus, it is actually a sesamoid bone. So therefore it is considered as the fourth ossicle of the middle ear. So when we discussed about the ossicles of the ear, we said that each middle ear consists of 3 ossicles. But if this is a separate sesamoid bone, so if you consider it separately, we can say 4 ear ossicles are present in each middle ear. So the fourth one is the lenticular process, which usually attaches to the incus. And in the hand, there is a sesamoid bone in the distal portions of the first metacarpal within the tendons of adductor pollicis and flexor pollicis brevis. So first, this is the first metacarpal. First is towards the thumb, second, this is third. So near the first metacarpal, we can see a sesamoid bone usually present in the adductor pollicis muscle or flexor pollicis brevis muscle. And these sesamoid bones are also appreciated in the wrist. So in the wrist, usually they are the pisiform bone, which is a carpal bone. Here I will show the pisiform bone, which is a carpal bone. So that is also considered as a sesamoid bone, which is present within the tendon of flexor carpi ulnaris muscle, and usually it develops at the age of 9 to 12 years. In the knee, we know the largest sesamoid bone. Here we can see in the knee, largest sesamoid bone is the patella, which is present within the tendon of quadriceps tendon, and fibula is also a sesamoid bone, which is usually present within the lateral head of gastrocnemius behind the knee joint. So here we can see the fibula sesamoid bone, where it is indicated with the arrow mark, and it is also a sesamoid bone which usually develops within the lateral head of gastrocnemius. And sesamoid bone is in the tendon of peroneus longus, where it binds around the cuboid. There may be a sesamoid bone in the peroneus longus as well, which near the ankle, near the cuboid bone it may be present in the foot. And there are two more sesamoid bones which are usually appreciated in the distal portions of the first metatarsal bone within the tendons of flexor hallucis brevis, which goes to the great toe in the foot. So these are the other locations of sesamoid bones. So this is in short about the sesamoid bones. Next, about the pneumatic bones. Pneumatic bones are the irregular bones which contain the air-filled cavities within them. So they are irregular bones which contain the air-filled cavities, and they are generally produced during the development of excavation of the bone. So when the bone develops, it develops like a solid bone itself. Later the bone gets excavated, it is removed by formation of pneumatic diverticula or air sacs, and from an air filled space such as nasal cavity. So they are projections from the nasal cavity forming paranasal air sinuses. So pneumatic bones are the frontal bones which are shown here. Usually the air sinuses are present here on each side in the frontal bone, and the largest air sinus is the maxillary, which is shown in orange color. The sphenoid bone present in the posterior side in the base of the skull. Then ethmoid forms the roof of the nasal cavity. So these are the pneumatic bones. Even the mastoid antrum, which is present posterior to the external acoustic meatus. So the mastoid process also contains the air-filled spaces, which is also an example of pneumatic bones. So they are generally produced during the development of excavation of the bone by pneumatic diverticula or air sacs, and they are air-filled spaces such as they are projections from the nasal cavity. So whatever air we inhale inside, they directly won't enter into the trachea. Instead, the air enters into these paranasal air sinuses, and it gets humidified, and the temperature is also maintained to a body temperature. Then it goes back to the respiratory tract. So that is the main function of paranasal air sinuses, and also it reduces the weight of the skull because they are air-filled bones. So at birth, the mastoid is not pneumatized, but it becomes aerated over the first year of life. So that thing you have to remember. Mastoid is not pneumatized at birth, it gets aerated after first year of life. So here in this image we can see the cartilaginous ossification still more in detail. So we can divide into step 1, step 2, step 3, step 4 and step 5, where the cartilaginous ossification involves the primary center of ossification. So in step 1 we see first the cartilaginous model is placed, and in step 2 we can see the appearance of the primary ossification center. This is the primary ossification center, and we can see the periosteal collar. So here is the periosteal collar. So the primary ossification center in long bones, they appear in the diaphysis, they appear in the shaft, it never appears in the epiphysis. So it appears in the shaft, and the primary ossification center, it starts usually appearing during 6th week of intrauterine life, and then the chondrocytes multiply and form the trabeculae, and cartilage is progressively eroded and replaced by bone, and extending towards the epiphysis. Slowly we can see the ossification, it starts extending towards the epiphysis, that is the ends. And a perichondrium layer, that is the outer covering, it is surrounded by the cartilage, forms the periosteum. Slowly the perichondrium turns to form periosteal collar, which you can see in step 2. and then which generates to form osteogenic cells. So this periosteal collar later it gives rise to osteogenic cells, and that make a collar to encircle the exterior of the bone and remodels the medullary cavity on inside. The nutrient artery now enters inside the bone via the nutrient foramen from a small opening through of a diaphysis. It invades the primary center of ossification, bringing the osteogenic cells like osteoblast on outside and osteoclast on the inside. So the canal of the nutrient foramen is directed away from more active end of the bone. So it is directed away from the growing end of the bone. So when one end grows more than the other, so when the bone grows at the same rate at both ends, the nutrient artery is always perpendicular. So usually the nutrient artery is away from the growing end. That's how we see the direction of the nutrient artery. But if both the ends are growing at the same rate, both epiphyses, upper and lower epiphyses are growing with the same rate, then the nutrient artery will be usually perpendicular. Next, about the secondary center of ossification, here we can appreciate in the step 4, in the epiphysis we can see the appearance of ossification centers which are considered as secondary ossification centers. The secondary ossification centers generally appear at the end of epiphysis of the long bones, and the secondary ossifications mostly occurs after birth. So these appear mostly after birth, except for the secondary centers around the knee joint, that is the distal end of the femur and proximal part of tibia. So except for the distal around the knee joint, that is the distal end of the femur and the proximal tibia, which appear during the last week of the fetal life, immediately after birth they appear. Except for those rest of the epiphysis, the secondary centers usually appear after birth only. And the epiphyseal arteries and the osteogenic cells invade the epiphysis, depositing the osteoblast and osteoclast, which erode the bones, but only one end of the digits and the ribs. That is, if you see the ribs and the digits, we can see the epiphysis only at one end, and the rest of the long bones, if you see, the epiphyses are present at both the ends. So the diaphysis of the long bones contains the primary ossification centers. So the ossification center which appears prenatally, that is ossified at birth prenatally, are the long bones, diaphysis of long bones, skull bones, vertebral column, ribs and sternum, and even the few foot bones like talus, calcaneum, cuboid. And primary center of all the carpal bones and tarsal bones except for the talus, calcaneum and cuboid, they appear after birth. So here we can see the appearance of primary ossification center, and we can see the secondary ossification center which appeared in the epiphysis here. Now we can appreciate the epiphyseal cartilage. This is the metaphyseal plate which is present near. Usually the blood vessels will loop here in the metaphysis. This is the epiphyseal cartilage, which is the growing end of the long bone, and where it is slowly starts replacing by bone and bone starts extending and growing. And we can see the articular cartilages as well covering the epiphysis. This is the articular cartilage which covers the epiphysis, and diaphysis containing the medullary cavity. So inside the hollow cavity will form, which is called as the medullary cavity, filled with the bone marrow.